Workplace health and safety is an important consideration for businesses. Duty holders within businesses must consider their workplace activities and the environment in which these take place. Duty holders, which include employers and employees, must identify hazards, assess risks, and ensure suitable control measures are in place. The aim of this Health and Safety Infobyte is to introduce and explain the benefits of workplace health and safety, and to outline and simplify the subject of workplace health and safety. The objectives include explaining the reasons why you need to consider workplace health and safety, identifying and outlining who has health and safety responsibilities and what these are, identifying and outlining the basics of health and safety you as a duty holder should be aware of, and actioning. Legal obligations. As an employer or an individual running a business in the UK, you are subject to UK law in respect to health and safety. You've probably heard of the Health and Safety at Work, etc. Act 1974, the principal piece of health and safety legislation in the UK. In addition to this, there are multiple health and safety regulations which are subject specific. For example, regulations considering manual handling, chemical safety, electrical safety, and so on. Moral obligations. As an employer, you have a moral duty to do all you can to protect the health, safety, and welfare of your workforce or others who may be affected. You should be able to perform your work or go about your daily business without having the fear of being injured or becoming ill. A workplace where there is a positive health and safety culture may help to promote a safe and efficient workforce. Financial obligations. Inadequate health and safety measures may result in significant loss or financial damage to a business. Investing time and effort in proper health and safety makes good long-term business sense, with possible financial benefits including reduced insurance premiums, reduced expenditure on equipment, reduction in lost time incidents. Both employers and employees have and share workplace health and safety responsibilities. These are outlined on the slide and are detailed in the Health and Safety at Work Act 1974. Employers' responsibilities include assessing risk, implementing controls, equipment provision and maintenance, and providing suitable information, instruction and training. Employees' responsibilities include taking reasonable care for their own health and safety and cooperating with their employer. Employers and employees are required to cooperate, coordinate and communicate on health and safety matters, and there may be a requirement for formal consultation arrangements to be in place, for example, including trade union representatives. Employers should have arrangements in place for effectively managing workplace health and safety. This may take the form of plan, do, check, act cycle as shown on the slide. This is further explained in the following slides. Employers must make suitable plans to allow health and safety to be effectively managed. This will include development of a health and safety policy, emergency procedures which may be required, for example, emergency evacuation and incident response, establishing if you may require additional health and safety support, including employees when making these plans, identification of applicable legal requirements. In practice, businesses must put their health and safety plans into action to ensure risks are dealt with sensibly, responsibly, and proportionately. This may include completing risk assessments, training, instructing, and informing employees, ensuring adequate supervision is in place, providing adequate resources, for example, equipment, facilities, and arrangements. Particular consideration should be given to vulnerable groups, including young persons, workers who are new or inexperienced, employees whose first language is not English, new and expectant mothers. Employers must ensure that their current arrangements are effective in managing health and safety and make changes where necessary. An employer may choose to implement workplace monitoring, for example, routine safety inspections or audits, or may use information from accident reporting or health surveillance to help inform decisions. Based on the results of checks, an employer should make relevant changes, update documentation, and/or implement any other necessary corrective actions. There are basic considerations all employers must take, which are shown on the slide. Risk assessments must be undertaken by a competent person, and HSE recommends a 5-step process to conducting a risk assessment. 1. Identify the hazards. 2. Decide who might be harmed and how. 3. Evaluate the risks and decide on precautions and controls. 4. Record your findings and implement. 5. Review your controls. Where there are 5 or more employees, including part-time employees and volunteers, risk assessments must be recorded. Information, instructions, training. Everyone who works for you needs to know how to work safely without risks to health. Employers must provide clear instructions, information and adequate training for employees and contractors or self-employed people who may be working for you. If you employ anyone, you must display the health and safety law poster or provide a pocket card to each worker. First aid. Employers should provide adequate and appropriate equipment, facilities and personnel to ensure their employees receive immediate attention if they are injured or taken ill at work. Employers should have suitable arrangements for the maintenance and safety of installations, equipment and services. For example, electrical safety, gas safety, water safety, pressure systems, lifting equipment. A specific consideration an employer should be aware of are certain work-related injuries, diseases and dangerous occurrences. A report must be received by the Health and Safety Executive within 10 days of the incident, unless it is an accident that results in over 7 days incapacitation of a worker. In that case, the report must be received within 15 days. A full list of items that are reportable and means of reporting are available online via the HSE website. Health and safety practice and protocol is an important element of your organisation's identity. Workplace health and safety legislation exists to protect those at work from harm, and compliance mitigates unsafe practice and associated risks which can result in accidents, injuries, fatalities, fines and imprisonment. Good health and safety practice protects workers and can support organisational reputation through reduced likelihood of sickness absence, increased productivity, economic gain, and workforce culture and morale. For further free and confidential health and safety advice and guidance for your workforce, contact Workplace Team at fife.hwlfife@nhs.scot.